Gentlemen, if you're over 60, have you ever wondered, is constantly having to sneak off to the bathroom in the middle of the night just getting old? Or is there a more alarming truth hiding beneath the surface? Thousands of men are missing critical red flags from their own bodies, the early signs of prostate cancer they simply cannot afford to ignore. I'm Dr. Nash, and after decades in men's health, I truly understand your concerns. Today, I'm going to reveal the 3 most common early warning signs you need to recognize immediately to protect your life. Stick with me through this video because I'm also going to share one simple, often overlooked secret to keeping your prostate healthy. All right, let's talk about something many of us just accept as normal after 60. Those changes in how you pee. Maybe you're finding yourself heading to the bathroom more often, especially at night. Or perhaps it takes a little longer to get the stream going, or it just isn't as strong as it used to be. Sound familiar? I hear these concerns from my patients all the time, and while they're incredibly common, they can also be prostate cancer early symptoms. Now, before you get worried, let me be clear. These urinary changes are very often due to a non-cancerous condition called benign prostatic hyperplasia, or BPH. That's just a fancy way of saying your prostate gland, which sits right below your bladder, has gotten a bit larger with age, squeezing the urethra that carries urine out. It's incredibly common. In fact, the Cleveland Clinic states that by age 60, over half of men have BPH, and by 80, it's nearly 90%. However, here's the crucial point. These exact same symptoms can also be early indicators of prostate cancer. According to the American Cancer Society, about 1 in 8 men will be diagnosed with prostate cancer in their lifetime. And for many of those men, subtle changes in urination are among the first clues. If you ignore these changes, thinking it's just old age, you could be delaying a diagnosis when treatment is most effective. This isn't just about physical discomfort. Constantly interrupted sleep from frequent bathroom trips can affect your energy levels, memory, and even your mood and confidence. You're just not feeling as vital or sharp as you could be. One of the biggest misconceptions I see is men just shrugging it off. They think, oh, my dad had this, it's just what happens. While family history is important, assuming it's only BPH and avoiding a doctor's visit is a big mistake. You absolutely cannot self-diagnose. So, what can you do at home right now? Here's a simple step. Start a urination diary for a few days. Just make a quick note of how often you go, especially at night, and if you notice any difficulty or changes in stream. This isn't about solving the problem. It's about gathering information for your doctor. Also, try to limit fluids a couple of hours before bedtime to help reduce those nighttime wake-ups. These small observations can provide valuable clues when you discuss your symptoms with a professional. Now, let's talk about another area many of us, especially after 60, tend to brush off. Those nagging aches and pains. Maybe it's a persistent lower back ache you blame on an old sports injury, or a dull discomfort in your hips you just attribute to getting older. We've all been there, right? But here's why we need to pay closer attention. While less common than urinary issues in the very early stages, certain localized pains can sometimes be signs of prostate cancer. You see, while most early prostate cancers don't cause pain, as the disease progresses, or in some cases, even in earlier stages, pain can emerge. This often happens if the cancer spreads to the bones, which is unfortunately a common site for prostate cancer to travel to. The pain might feel like a deep ache, stiffness, or even tenderness in specific areas. The Mayo Clinic points out that unexplained pain in the lower back, hips, or thighs can be a symptom. It's not about causing alarm, but about being aware that your body might be trying to tell you something important. The big mistake I often see men make is simply attributing all these aches and pains to typical aging, arthritis, or a minor strain. We're great at convincing ourselves it's nothing serious. But ignoring persistent, unexplained pain doesn't make it go away. It just delays potential action. Living with chronic pain, no matter the cause, can drastically drain your energy, affect your sleep, and wear down your spirit. It chips away at your overall vitality and how you engage with life. You might find yourself less active, more irritable, and even struggling with focus or memory because your body is constantly sending pain signals. So, how can you tune in a bit more? First, pay close attention to persistent discomfort. If you have a pain in your lower back, hips, or upper thighs that just doesn't resolve with rest or typical remedies, make a note of it. Try a warm bath or some gentle stretching to see if it's just muscle soreness. If the pain is deep-seated, persistent, and not improving, that's a signal to investigate further. This isn't about self-diagnosing, but about gathering information for your doctor. Being proactive means giving your doctor the full picture, allowing them to truly assess what's going on and help you regain that vitality you deserve. All right, let's move on to a topic that I know can feel a bit more sensitive, but it's incredibly important for our overall health and vitality as we get older. Changes in your sexual health. Many men, especially after 60, might experience some shifts here. Perhaps it's new difficulties with erections or a change in how ejaculation feels. It's easy to just chalk these things up to age, and while aging certainly plays a role, these subtle changes can sometimes be a clue about how to identify prostate cancer. While these aren't typically the first signs, and they're less common than urinary issues as an initial symptom, it's vital to know that prostate cancer can impact sexual function even in its earlier stages. The prostate gland plays a key role in male reproductive health. When something is amiss there, it can affect things like erectile function or ejaculation. For instance, the American Urological Association notes that new-onset erectile dysfunction or changes in ejaculation can, in rare cases, be a symptom that warrants further investigation, especially when coupled with other concerns. The biggest hurdle I see here is often embarrassment or shame. Men tend to keep these issues to themselves, not even discussing them with their partners, let alone their doctor. This is a crucial mistake. Delaying this conversation means delaying potential diagnosis, and that can have significant consequences for your long-term health and even your energy, confidence, and overall zest for life. Think about it. When sexual health is compromised, it can impact your relationships, your self-esteem, and your sense of vitality. So what can you do? First, foster open communication, especially with your partner. Talking about these changes can be incredibly liberating and helpful. Second, become a keen observer of your own body. Notice if you're experiencing any new difficulties achieving or maintaining an erection. Also, pay attention to any pain during ejaculation, or, though less common, blood in your semen. If any of these persistent changes pop up, please don't just dismiss them. A simple conversation with your doctor can help determine the cause and get you the right support, allowing you to regain your full confidence and vitality. Gentlemen, the greatest wealth we truly possess isn't measured in dollars, but in the vibrancy of our health and the quality of our days. What we've discussed today isn't about fear, it's about empowerment through awareness. You've just learned to recognize 3 crucial, yet often overlooked, early indicators of prostate cancer. Those subtle shifts in urination, unexplained aches, and changes in sexual health. The profound truth here is that early detection is your absolute best defense. This isn't just a saying, it's a medical fact. For localized prostate cancer, the 5-year survival rate is nearly 100%. That alone should tell you everything about the immense power of paying attention and acting quickly. Regular checkups, including a PSA blood test and a digital rectal exam, especially if you're over 50 or earlier with a family history, are your greatest allies. So as you step away from this video, I want you to carry one simple, incredibly powerful piece of advice. Tune in to your body, not gently, but consistently. It's always sending you signals. Maybe that means taking a moment each week to reflect on how your urinary habits have been, or if any new persistent aches have emerged. Don't dismiss what your body is trying to tell you. Maintaining a healthy lifestyle, a balanced diet, regular exercise, and a healthy weight all contribute to overall prostate health. And don't hesitate to talk to your family about their health history. It can help your doctor assess your risk more accurately. This journey of aging well isn't about avoiding challenges. It's about facing them head-on with knowledge and proactive steps. Don't let apprehension or old habits hold you back. Your health is worth every ounce of effort. If you found this information genuinely helpful, please consider giving this video a like. It helps ensure this vital information reaches many other gentlemen who need it. This is just one part of the bigger picture, and I'll always be here to walk you through it.